इसमें बोलना है? Yes. अच्छा. So we are discussing the differences between the general anesthetics and local anesthetics. So the general anesthetic produces loss of consciousness, while in local anesthetics the consciousness remain intact. Okay. Then apart from loss of consciousness and loss of pain sensations, the general anesthetics also produce some other pharmacological actions, like they cause amnesia, means loss of memory. They produce immobility. They will cause skeletal muscle relaxation. So these are the important features of general anesthetics. And one more important thing is that they will produce abolition of the somatic and autonomic reflexes. Can anyone tell what is autonomic reflexes? Can anyone tell what is autonomic reflex? Like for example, pharyngeal reflex, corneal reflex. These are the autonomic reflexes. Okay. So they will produce loss of somatic and autonomic reflexes. For example, pharyngeal reflexes. What can anyone explain what is pharyngeal reflex? Normally when we sleep, why there may be regurgitation of food upward, but normally food does not go into the trachea. Why? Because whenever the food touches the pharynx, what happens that there is closure of the glottis. So that's why the food doesn't go in the trachea. Okay. So normally there is no risk of aspiration. But whenever the person become totally unconscious, general anesthetics produce loss of pharyngeal reflexes. So what will happen that if the patient has taken any food and it goes upward, then what will happen? The glottis will not close, and that food can go into the trachea, and that can cause very serious situation that is known as aspiration pneumonia. That can cause even death. That's why before giving general anesthesia, patient is asked that he should be at least he should not take any food for at least 6 to 8 hours. That's why the patient should be kept nil per orally, NPO. Okay, so this is pharyngeal reflexes. Okay, so all the general anesthetics produce loss of pharyngeal reflexes, except some few general anesthetic, for example, ketamine. It doesn't produce loss of pharyngeal reflex. That's why it can even be given in cases of full stomach. If the patient is full stomach, suppose if a patient take breakfast and goes outside and he undergoes road traffic accident, and now he is shifted to emergency OT, and if he needs some operative procedure, then we can use ketamine. Okay. Then coming to the brief historical introduction. So the scientist Horace Wells, who was a dentist, first of all used the nitrous oxide as anesthetic. As you know, nitrous oxide is a gas, and it is also known as one of the laughing gas. And he used nitrous oxide for the purpose of tooth extraction. Okay. Then coming next is Morton gave a demonstration of the ether. Ether was previously very commonly used as general anesthetic drugs, but nowadays it is not used. Why? Can anyone tell why? Anyone? Why ether is not used nowadays? Yes? Because it is a highly volatile, okay, and it also irritates the mucosa. So what will happen if a drug is highly volatile? We cannot use cautery with it. Okay, what is cautery? During the surgery, if we, for example, do any surgery, surgeon makes incision. Suppose if there is cut occurs, and obviously if there is cut, there will be bleeding. Okay, so during the surgery, it is very difficult to search some bleeders because there are very small vessels. So if we explore bleeder vessels, then it will take too much time. Okay, so to prevent bleeding, normally cautery is done to prevent the bleeding. It coagulates the blood vessel. Okay, but we can't use cautery with ether and other volatile drugs. So that's why the ether is not used nowadays. Then chloroform was used by the Simpson as a anesthetics. Then halothane was discovered in 1956, and the first IV anesthetic thiopental was introduced in 1935. So this is the brief historical background. Now coming to the mechanism of action. So general anesthetic action has been related to some common physiochemical properties of the drugs. Mayer and Wharton pointed out a direct parallelism between lipid water partition coefficient of the general anesthetic and their anesthetic potency. So lipid water, higher will be the lipid water partition coefficient, higher is the lipid solubility, and more will be the potency of the general anesthetics, because more easily it can cross the biological membranes. Okay, so more is the lipid solubility, more will be the potency of the general anesthetic, and this is correlated with an parameter which is known as minimum alveolar concentration, or MAC. MAC is the lowest concentration of the anesthetic in the pulmonary alveoli needed to produce immobility in response to a painful stimulus in 50% of the individuals. So it is the lowest concentration of the anesthetic, okay, that can cause immobility in response to painful stimulus. So MAC is inversely related to potency. Okay, less will be the MAC, more will be the potency, and more will be the MAC, less will be the potency. So the nitrous oxide has highest MAC, means it is the least potent general anesthetic. Okay, nitrous oxide has a MAC number of 104%, and the minimum MAC किसका होता है? Minimum MAC methoxyflurane. Okay, it has the minimum MAC, so it is the most potent general anesthetic. And nitrous oxide has highest MAC, so it is the least potent general anesthetic. You can see that methoxyflurane, it has the least MAC, okay, and nitrous oxide has highest MAC. So sorry, this is not MAC, this is oil gas partition coefficient, which directly correlate with lipid solubility. So the principal locus of causation of unconsciousness appears to be in the thalamus or reticular activating system. So the unconsciousness occurs by the action of general anesthetics on the thalamus and reticular activating system. As you know, reticular activating system is responsible for making alertness and making consciousness, and the amnesia occurs because of the action in the hippocampus, amnesia or loss of memory. Then spinal cord is the likely seat of immobility on the surgical stimulation, and the ligand gated ion channels are the major targets of anesthetic action. And the most important ligand gated ion channel is GABA GABA mediated chloride channels. Okay. So these are the most important targets of general anesthetic drugs. So the GABA operated chloride channels are the most important sites of action. So the different anesthetics may be acting through different mechanisms. For example, GABA A receptor gated chloride channel is most important, and many inhalational anesthetics potentiate the action of the inhibitory neurotransmitter GABA to open the chloride channels. So they potentiate the action of the GABA. And some fluorinated anesthetics in addition inhibit the neuronal cation channels gated by the nicotinic cholinergic receptors, which may mediate the analgesia and amnesia. So the major action is GABA A receptor gated chloride channel. However, there are other additional mechanisms also possible. Okay. So this is the benzodiazepine. This is the chloride channel, GABA A mediated chloride channel. Whenever the GABA binds, whenever the action of GABA increase, what will happen? That this channel will open, and as you know, opening of chloride channel leads to hyperpolarization. Okay. Pardon? Are you a student? देखने से तो नहीं लग रहा. इधर आओ. आप इतना लेट क्यों आ रहे हो? You are coming 8:23. Sorry, not allowed. Okay. So binding of GABA leads to opening of the chloride channel. This will produce hyperpolarization, and hyperpolarization leads to decreased activity of the neurons. Then nitrous oxide and ketamine, they selectively inhibit the excitatory NMDA type of the glutamate receptors. Okay. So there are also excitatory type of receptors are present in the CNS, which are known as glutamate receptors. So glutamate receptors are also further subdivided into various types like NMDA, AMPA, and these are excitatory in nature. So the nitrous oxide and ketamine, they act by inhibiting the excitatory type of glutamate receptors. Then coming to the stages of anesthesia. So the general anesthesia, the general anesthetics has 4 stages: state of analgesia, delirium, then surgical anesthesia in plane 1, 2, 3, 4, and medullary paralysis. Okay. So these are the 4 stages of general anesthesia, but with modern day anesthetics and use of multiple drugs, now typical these stages, we don't meet these stages, but you should know grossly what are the different stages. Okay. So most of the surgeries are done under surgical anesthesia, plane 2 to 3. Okay. And this basically indicates the depth of anesthetics. As we increase the dose of general anesthetic drugs, the stage will go from analgesia followed by delirium followed by surgical anesthesia. In the surgical anesthesia, there is loss of corneal reflex, pharyngeal reflexes. Okay. And if we further increase, if we give very high dose, they may cause death because of the medullary paralysis and respiratory depression. So at supraanesthetic dose, all the anesthetic agents can cause death by loss of cardiovascular reflexes and respiratory paralysis. Most anesthetic agents cause cardiovascular depression by effects on the myocardium and blood vessels as well as on the nervous system. So most of the general anesthetics, they depress the cardiovascular system by action on heart and blood vessels. Then the halogenated anesthetics are likely to cause cardiac arrhythmias accentuated by circulating catecholamines. So halogenated anesthetic, for example halothane, it sensitizes the myocardium to the action of the adrenaline. Okay. So they can cause cardiac arrhythmias. That's why as you know, halothane should not be used for surgery in patients of pheochromocytoma. Okay, because pheochromocytoma is a catecholamine inducing tumor, catecholamine producing tumor. If the catecholamines are already high, then what will happen? Then it will sensitize the heart to the action of the catecholamine, and it can cause cardiac arrhythmias. So that's why the halothane should not be used in patients of pheochromocytoma for the purpose as general anesthetics. Then coming to the their pharmacokinetics. So the general anesthetics, they first if they are given by the inhalational route, they first go into the pulmonary alveoli, from where pulmonary alveoli they will go to the blood, and from blood they will go to the brain. Okay. So in this direction, at the induction of anesthesia, the general anesthetic go from alveoli to blood followed by brain. Okay. And at the recovery, the sequence gets reversed. At the recovery happens when the general anesthetic diffuse out of the brain into the blood followed by the alveoli. So the factors affecting the partial pressure of anesthetics attained in the brain are partial pressure of anesthetic in the inspired air, pulmonary ventilation, alveolar exchange, solubility of anesthetic in the blood. Okay. So if the blood solubility will high, what will happen? इंडक्शन स्लो होगा या फास्ट होगा? इंडक्शन स्लो हो जाएगा अगर ब्लड में ही रहेगा जनरल एस्थेटिक, सो इट विल नॉट गो इनटू द ब्रेन इजीली. ओके. सो द onset of action is inversely proportional to the blood solubility. For example, nitrous oxide has very high blood solubility. Okay. So it has very slow onset of action, and it also depends upon the solubility of anesthetic in the tissues. For example, the solubility in the adipose tissue, solubility in the brain. Then it also depends upon the blood flow in the brain, which is known as cerebral blood flow. So these are the factors which affect the concentration, onset of action, recovery of general anesthetics. These are the various pharmacokinetic factors, like blood solubility, solubility in the tissues, alveolar exchange, pulmonary ventilation, and partial pressure of anesthetic in the brain. And the elimination, second gas effect and diffusion hypoxia. What is second gas effect? We will study these things when we will talk about nitrous oxide. Okay. These are the various techniques of an inhalation, like open drop method, through anesthetic machines like Boyle's apparatus or Boyle's machine, closed system and semi-closed system. So these are the various techniques of inhalation. Then this is the Boyle's machine. You can see that this is the blue color cylinder. So blue color cylinder में क्या होता है? Which general anesthetic is kept in blue color cylinder? Anyone? Blue means Neela. Neela is nitrous oxide. Okay. So nitrous oxide is kept in the blue colored cylinders. Okay. And this is cylinder black with white shoulder. ये किसका है? Which gas is kept in this? Black with white shoulders. Anyone? You must have seen in the hospital wards oxygen. Yes, very good. So oxygen is kept in the black with white shoulder. So why there is specific color is used? Can anyone tell? Why there is color coding? Anyone? This is done as a safety system. Okay. To prevent that we should not use any wrong cylinders. Okay. Because the visual memory is very important. Okay. Suppose a OT technician is working in the operation theater, and he used to see that blue color cylinder is fitted here, but by mistake if someone keeps another cylinder, so he can immediately recall. Okay. So that's why it is the color coding of the cylinders. This is done for the safety of patients. Okay. So these are the various size of endotracheal tubes. You can see this is known as the bougies. These are the used for during intubation, tracheal intubations. Then these are the laryngoscope. These are also used at the time of tracheal intubation. Then this is the showing the glottis, which is the opening of the trachea, vocal cords, epiglottis. This is the nasal intubation is also done. So what should be the properties of an ideal anesthetic agents? For the patient, what are the various properties that are suitable for the patient? First is safety, patient safety. Okay, it should be the non-toxic for the liver, kidney, brain, heart. Okay, so it should be the non-toxic, number one. Okay, it should produce proper analgesia, amnesia. Then for the surgeon, what are the ideal properties? For the surgeon, it should produce proper immobility, proper muscle relaxation. Okay. Then for the anesthetics, what are the ideal properties? That it should cause quick induction and quick recovery. It should have fast onset of action. Then it should be the non-irritating. Then it should be non-volatile, so that cautery can be used during the operation. So these are the ideal properties for the patient, for the surgeon, and for the anesthetist. Then general anesthetics can be classified as inhalational agents and volatile liquids. Okay, in the inhalational agents we can use the gas, which is nitrous oxide, and in the volatile liquids we have various agents like ether, halothane, enflurane, isoflurane, desflurane, sevoflurane. So these are the various volatile liquids. And second category is one is inhalational. Inhalational is further divided into gas and liquid, and second is intravenous agents. The inhalational agents, these are also known as maintenance agent, because these are used for the maintenance of anesthesia. Okay, and second is IV intravenous agents, or these are also known as the induction agents, because these are used to produce the induction of anesthesia. Okay, because they act very fast. So the important intravenous agents are thiopentone sodium, methohexetone sodium, propofol, etomidate, and ketamine. So these are the important IV inducing agents. You can add one more, that is ketamine. So inducing agents are used for the induction of anesthesia, while the inhalational agents, these are used for the maintenance of anesthesia. Okay. Then there are some anesthetic adjuvants or slower acting agents are available, which are used to supplement the general anesthetic drugs. For example, benzodiazepines like diazepam, lorazepam, midazolam, these can be added as a anesthetic adjuvants because they also produce the various, and as you know, benzodiazepines has also got anxiolytic action. They can also cause muscle relaxation. They have also got anti-epileptic action. So they will supplement the action of general anesthetics. So these are the slower acting agents. Then there is one more very important agent that can cause dissociative anesthesia. Example is ketamine. So ketamine can cause dissociative anesthesia. Why it is called dissociative anesthesia? Okay, we will study later. Then coming to the opioid analgesics, then fentanyl. Fentanyl is an opioid analgesic which is used to potentiate or supplement the general anesthetic drugs because it is a very strong analgesic. So coming to the intravenous anesthetics, first is thiopenton sodium. Okay. So as you know, thiopenton belongs to the barbiturate class of the CNS depressant, and it has very high lipid solubility. And because of very high solubility, it will produce loss of consciousness within 10 to 11 seconds. Okay. As soon as it is injected IV, the patient will remain unconscious after 10 seconds. So it has very high onset of action. Why very high onset of action? Because of very high lipid solubility. Okay. But as you know, it has very high lipid solubility, so it will produce very fast onset of action. But because of the high lipid solubility, what happens that it first go from blood vessel to the brain. Okay. But because of this special feature, that's very high lipid solubility, what will happen that it has very short duration of action. Because the reverse also happens, means because of very high lipid solubility, it again goes from the brain to the blood and followed by less vascular organs, less vascular tissues, for example, adipose tissues, muscles. Okay. So that's why there is one disadvantage, that it produces very short duration of action. So it is, that's why it is used only for the induction of anesthesia. Okay. So this is known as redistribution. So its action terminates by redistribution. So first it goes to the brain, and because of very high lipid solubility, it again come back from brain to the blood and followed by less vascular tissues. So this process, whole process is known as redistribution. So its action terminate by redistribution. Its action do not terminate by the excretion or metabolism. Its action terminate by redistribution. So redistribution is very important. Okay. Another important feature of thiopenton is that normally it is given by intravenous route, but sometimes what happens that if due to some accidental injection, due to some accidents or due to some fault, if it goes into the arteries, what will happen that it can cause very severe pain because of the coagulation of the blood vessels. So normally what will happen, if any needle goes to the vein, normally if it goes in wrong place, what will happen that we should pull out needle. But in case of thiopenton, we should not pull out needle. Okay. Instead, we should give the some another drugs, like we can give anticoagulants, and we can give like heparin, we can give heparin, and through the same needle to prevent the clotting of that blood vessel. So if thiopentone is giving in the intra-arterial injection, then we should not pull out the needle. Instead, we should give anticoagulants and some painkillers through the same needle. And redistribution is very important because its action terminates by redistribution. What is redistribution? Can you explain what is redistribution? It is already written in the slide. क्या होता है बताइए, जस्ट टेल. लिखा हुआ है स्लाइड में. Pardon? Metabolism? Why redistribution happens? What happens that because of very high lipid solubility, it quickly goes from blood to the brain. But because of very high lipid solubility, it again comes from brain to the blood, and it goes to the less vascular tissues like muscles, adipose tissue. So this whole process is known as redistribution. So it produces very fast onset of action, but its action terminates within 5 to 10 minutes. Okay. So this is known as redistribution. Okay, please sit down. So accidental injection of thiopentone around, it can cause local tissue necrosis and ulceration. Immediate injection of procaine through the same needle is the recommended procedure if this accident happens. Thiopentone, like other barbiturates, can precipitate an attack of porphyria in susceptible individuals. Then other uses of thiopentone क्या है? For the control of convulsions occasionally, it can be used as an anti-epileptic drug in case of status epilepticus, and for the narco test of the criminals. Okay, so these are the other uses of the thiopentone. Then coming to the etomidate, it is similar to thiopentone but more quickly metabolized. There is less risk of cardiovascular depression, so it does not cause cardiovascular depression. Okay, so etomidate is very commonly used for the cardiovascular surgeries because it does not depress the heart. But there is one disadvantage, that it can cause adrenal suppression. It can decrease the production of the hormones from the adrenal gland. So it is used for the cardiovascular surgeries, but it can cause adrenal suppression. Then coming to the propofol, it is also very rapidly metabolized, very rapid recovery, no cumulative effect. It is useful for the day care surgery. What is day care surgery? क्या होती है आप बताओ. No idea. Okay. So the day care surgery is when the patient is not admitted in the hospital. Okay. He is hospitalized in the morning and discharged at the evening. Okay. So this is the day care surgery. Sit down. So it is it is almost, we can say that it is the most commonly used IV inducing agent. But it should not be used if a patient is having egg allergy, because it's used in the form of oily liquid 1% emulsion which contain egg albumin. So it is contraindicated in those individuals who has having allergy from the eggs or albumin. Okay. It lacks airway irritancy, but it is the most painful injection. The injection of propofol is the most painful injection. And it can be used both in the form of the intermittent injection as well as continuous infusion with the help of infusion pump. So it can be given intermittently as well as continuous IV infusion with the help of the infusion pump. And one more important feature is that it has, because of anti-emetic action, it decreases the chances of post-operative nausea and vomiting. So it is very commonly used as IV inducing agent. And pain during the injection is frequent because, as I have already told, it is the most painful IV inducing agent, and it is a costly drug. Then coming to the ketamine. Ketamine was first synthesized in 1962 in an attempt to find a safer anesthetic alternative to PCP. What is PCP? Phencyclidine, which was more likely to cause hallucinations and seizures. Okay. Previously phencyclidine was used, but it was known to cause hallucinations and seizures. So instead of, so that's why it is not used nowadays. It is basically hallucinogen. It can cause hallucinations. And the drug was first used on American soldiers during the Vietnam War. So ketamine is very important IV inducing agents. Okay. And you can remember the action with the help of mnemonic ketamine. K stands for kids. So it is the IV inducing agent of choice in children. Okay. E stands for emergence reactions. So what is emergence reaction? क्या होता है? It can cause various types of reaction, like it can cause hallucinations or disorientation at the time of recovery. So that is known as emergence reactions. Okay. Then T stands for thalamocortical junction. So most of the anesthetics, they act at the level of the cortex. Okay. So most of the anesthetics act at the level of the cortex. So they cause only loss of consciousness, but they do not cause analgesia, because as you know, which is the site of analgesia? Pain कहाँ पर जाते हैं? Pain fibers. What is the pain pathway? By which pathway the pain sensation goes to the brain? Anyone? Spinothalamic pathway. Okay. So the pain sensation goes into the brain, into the thalamus. So most of the anesthetics act at the level of cortex, but they do not suppress the thalamus. So most of the anesthetics are poor analgesics. Okay. As soon as the patient remain unconscious, he will not feel pain, but as soon as the patient will become conscious, he will feel severe pain. So most of the anesthetics are poor analgesics, but ketamine is a very good analgesics because it acts at the junction of the thalamus and cortex. Okay, so it suppresses both cortex as well as thalamus. Then M stands for meals. It can be given with full stomach, because I have already told most of the general anesthetic, they suppress the pharyngeal reflex. Okay, so they can cause aspiration pneumonia. Okay, but ketamine do not suppress the pharyngeal reflex. So it can be used even if the patient has taken meals. So it can be used even if the patient has taken full meals. So it can be used in full stomach patients. Okay. Then I stand for increase. So it increase all the pressure. It can increase blood pressure. it can increase intraocular pressure, it can increase intracranial pressure. So, it can be used in patients of shock. Those surgeries which surgery during the shock, okay. So, because it increases the blood pressure. Similarly, it's contraindicated in patients of glaucoma because it can increase the intraocular pressure and it can also increase the intracranial pressure. So, and it is a very good good general anesthetics in patient of bronchial asthma because it can cause excellent bronchodilation. And it acts by inhibiting the excitatory type of neurotransmitter, that is NMDA type of glutamate receptors. It acts by suppressing the NMDA type of the glutamate receptors, and it will produce dissociative anesthesia in which the patient remain consciousness though amnestic and insensitive to pain, okay, because it suppress both thalamus as well as cortex, so the patient remain drowsy and does not feel any pain. So, he thinks that he is dissociated from the surroundings. So, that is known as dissociative anesthesia. Now, we will briefly discuss the action of various IV inhalational agents. Okay, action of the inhalational agents. So, the first action in the central nervous system. Okay, so most of the inhalational agents, what will they produce? They increase the cerebral blood flow and they decrease the cerebral vascular resistance. So, because of which what happens that there will be increased cerebral blood flow, so they can increase the intracranial pressure. So, most of the inhalational agents, they cause rise in the ICT, intracranial tension, okay, except for few, for example, isoflurane, isoflurane, it does not produce relatively very higher rise in the ICT, so it can be used for neurosurgeries. Isoflurane. Then action on the heart. In the heart, most of the general anesthetics, they suppress the heart and blood pressure, heart and blood vessels. So, they can cause hypotension because of their depressant action on the heart and blood vessels. And also they suppress because they are CNS, basically they are CNS depressants. Because of their CNS depressant action, they decrease the blood pressure. They also suppress the central nervous system as well as they suppress the cardiovascular system. Then what are the important adverse effects of these anesthetics? They can cause hepatitis, for example, halothane. Halothane can cause hepatitis if it is used very frequently. Okay. Similarly, these fluorinated anesthetics, they can also cause malignant hyperthermia, which is manifested in the form of fever, rigidity, muscle rigidity. and it is treated by the drug, which drug? Dantrolene. Similarly, these anesthetics can cause post-operative nausea and vomiting, which is very common. Now, can we take break of 5 minutes? Okay. And after we will start next part. दो घंटे की है ना इनकी अभी. हाँ वो अभी 5 मिनट का. अच्छा इनका 5 मिनट का ब्रेक लिया है तो वो लगा रहने दे, लगा रहने दे. हाँ हाँ.